I wanted first to talk about overweight and obesity before pregnancy, or excess weight gain during pregnancy, because they both have the effect, negative effects. So in terms of the mother, the obstetric complications that she'll experience through this is gestational diabetes, which then leads to insulin resistance for her and the fetus. She's more likely to suffer preeclampsia, thromboembolism, and the rates of caesarean section are much higher in these women. When we look at the fetal or infant consequences, we see that even though folic acid has a role in neural tube defects, the NTDs, they are actually higher irrespective of the folic acid intake, they're higher in obese women and those who gain excess weight. And you get other birth defects as well, such as congenital heart disease. You're more likely to have a stillbirth, a neonatal death, and then the high birth weight, which is a risk factor for obesity in infancy and later childhood. And then the consequences of the child being overweight are that you get diabetes and cardiovascular health later on. So looking at this area is really important. Just to go on to the increased risk of childhood obesity, as I said, the structural and functional changes affect the insulin resistance, but they also elevate plasma cholesterol and the leptin hormone. And so these have a role to play in the high birth weight that the baby's born with, and then the rapid weight gain in infants, which is when they cross upwards on the weight for age centiles, so they can be following along one and then cross upwards. That's a risk factor for obesity. And also, some of the effects during pregnancy will cause a low birth weight or a small for gestational age. And if you then follow that on with rapid weight gain in infancy, that's another risk factor for childhood obesity. The problem with children having these factors and gaining weight very early in life, so before 5 years, is that they don't tend to lose that weight because growth hormones driving their growth, and we think partly their weight gain. So if they're overweight before 5 years, the study here, the last one here at the bottom, indicates that those children tend to retain that excess weight gain until they're 9. This was a study in the UK. So what should we be doing about this? And I know, did some of you attend the talk this morning from somebody from Wales? Yes. Sorry, I missed it, but I didn't. So I don't know what she talked about. But anyway, I just wanted to talk about these figures. Unfortunately, in the UK, we don't have recommendations on weight gain during pregnancy. So more and more we're looking at these ones, which are from the USA, and they were revised in 2009 by the Institute of Medicine. And they detail how much weight gain should be. Now, I'm hoping this... Oh, here we go. So if a mother's of a normal weight before pregnancy, that means her BMI is somewhere here, between 18.5 and 25. The weight gain that's expected is 11.5 to 16 kilos. Right? If you've got an overweight woman, her BMI is higher than 25 but lower than 30, she's expected to gain less. And then if you're obese, which means you're starting pregnancy with a BMI over 30, the expected weight gain is about 7 kilos. And also there are consequences if you're underweight before you begin pregnancy as well. That means your BMI is below 18.5. You're expected to gain more weight than a normal weight woman. Now normally you gain about 0.5 kilos to 2 kilos in the first trimester, and then the rest should be gained afterwards. And if you do have a lower weight gain in an overweight or obese woman, then you get better outcomes for pregnancy. So following these guidelines is becoming more accepted.